Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.
Hi everyone, this is Nitin Choda over at intouchemr.com with this special training on how to get patients to pay their balance. Now, we know that this can get really challenging. We know that the patient is usually the last payer because, the insurance company pays for it and they pay what's left. And unless, of course, the patient's a cash paying patient, in which case this training, by the way, becomes far more important. And we also know that as far as the patient is concerned, paying off their portion of their responsibility for their healthcare bills, for their outstanding balances, for them that's a low priority. Now, before you watch this video, I would strongly encourage you to search for the video Architecture of a Patient Statement in this actual channel and watch that video before you watch the rest of this training, because this training builds on top of that. Again, this training builds on top of the training Architecture of a Patient Statement. So let's get started. How to get patients to pay their balance. Now, the simplest way to get patients to pay their balance is to give them multiple options to pay. Again, let me repeat that. Give them multiple options to pay. Because here's what happens. Some patients may want to pay by cash. Some may want to pay by check. Some may want to pay with a credit card. Others debit card. And some may just want to pay with their bank account. It's just the way it is. In fact, the more options you give patients to pay off their patient statements, the better. Because what happens is the patient now doesn't feel like they have to pay a certain way. When you give patients more options to pay, specifically online options for younger patients, again, specifically online options for younger patients so they can quickly pay with a credit card or even pay with a PayPal account or even pay off their balance in small reoccurring payments. That's huge. Paying off their balance in small reoccurring payments, your chances of making sure that the patients actually pay increase significantly, because what you want to do as a practice owner, as a clinician, is you want them to pay their balance. In fact, there was a study done, and this study is referenced, and we've actually, it's a part of the executive briefing on the 5 blunders to avoid with EMR. By the way, you can get a copy of that executive briefing at intouchemr.com. A study was done that actually shows that patients are actually looking for online options to pay, yet a lot of providers don't offer them that option. So what you want to do as a provider is, it's your responsibility to make sure that you give the patient multiple options to pay. Like I said, credit card, debit card, cash, check, perhaps even a bank statement, perhaps even reoccurring statements. The more options you give patients to pay, the better. That's one thing. The second thing, should you turn over patients to a collection agency just so that you can get paid? Now, this is a tricky one. I've had a lot of practices hesitate to do that because you don't want to be perceived as the bad guy. You don't want to, you don't want to get a bad reputation with patients because it's a small community, and you don't want your patients to be upset with you and then go elsewhere. Here's the fact. What you have to do when patients come into your clinic is you have to make the patient aware of their financial responsibility from the beginning. You have to get patients to sign off on the fact that any outstanding balances have to be settled within X days. I'd prefer that any outstanding balances be settled within 60 days. If the balances aren't settled within 60 days, what you can do is you can have one simple, polite courtesy phone call from the clinic letting the patient know that there's an outstanding balance and you want them to settle it. And if that doesn't work, then my recommendation would be to turn the patient over to a collection agency. Because think about it, you're running a business, you're running a practice, you're in the practice, you have to treat the practice as a practice. I'm not saying that you have to be difficult with patients, but I'm saying you have to expect patients and tell them from the very beginning that they have to live up to their responsibility and they have to be able to meet their responsibility. Because after all, you have costs, the cost of healthcare is significant. You have costs associated with the cost of treatment, the cost of the clinicians, you have costs associated with the cost of staff, the cost of equipment, heck, all the training that you've done over the years, and even the cost of your own liability insurance. So, to get a patient to pay their balance, make sure that the patient's provided with multiple options to pay. We do that in the billing component of intouchemr.com, and we have many sophisticated mechanisms to remind the patient to pay, by the way. I would also recommend that your clinic should wait about maybe 15 to 30 days, then put in a polite phone call to the patient and let them know that there's an outstanding balance. And if the AR, if the accounts receivable for that particular patient is more than 60 days out and over a certain amount, let's say the amount is $200, then you want to perhaps turn the patient over to a collection agency, at which point it's their job to call the patient and make sure that the money does come into you, and collection agencies usually do that for a percentage of the amount that they collect. So to get patients to pay their balance, give them multiple options to pay, have a polite reminder, and if that doesn't work, then you may want to seek the services of a professional collection agency. Do that and you'll see your cash flow improve, because at the end of the day, you want your revenue cycle process, you want your actual cycle of revenue to be as short as possible, and a big part of that is patient statements, and you got to get patients to pay. Thank you so much for watching. Make sure you go to intouchemr.com to see how we can shorten your revenue cycle management process, how we can help you get paid faster with efficient, well-designed patient statements, and more importantly, request the executive briefing on the 5 blunders to avoid with EMR, and we'll be happy to ship that over to you. And that gives you even more information about how to get patients to pay their balance, whether you choose to work with us or not. Thanks so much for watching, and good luck getting paid by patients.
Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.